Good evening, you're watching the news from the Sultanate of Oman television. First, the headlines. The Ministry of Health announces 1,043 new confirmed cases of COVID-19 along with 1,079 new recoveries. The Ministry of Health launches the Nursing Now campaign to enhance the capabilities of those working in the healthcare field. And the foreign ministers of Turkey and Iran meet for talks. And now, live from this news center of the Sultanate of Oman television, here we present to you the details. His Majesty Sultan Haytham bin Tariq has sent a cabal of greetings to His Majesty King Mohammed VI of Morocco on the occasion of the success of his recent surgical operation. The Minister of Health announced 1,043 new confirmed cases of COVID-19, which brings the total number registered in the Sultanate to 24,524, including 108 deaths. The ministry stressed that 1,079 new recoveries were recorded, which brings the total number of COVID-19 recoveries in the Sultanate to 9,533 cases have been recovered. Within the efforts to limit the spread of COVID-19, the ministry advises all citizens and residents to keep on washing hands with water and soap. Avoid touching the face, nose, mouth and eyes. Follow hygienic habits when coughing and sneezing. Adhere strictly to social distancing instructions. Stay at home and not to go out unless absolutely necessary. Adhering to isolation and social distancing will prevent you, your family, and the community from COVID-19. Stay safe. The tests for COVID-19 continue in various wilayas of the Sultanate within the efforts to control this global pandemic. The Medical Fitness Center in Darset is one of such centers that received around 3,000 individuals during the last 2.5 months, among which 1,000 persons were test positive for COVID-19. The medical cadres in the center exert to no-stop efforts to test the individuals that to come to the center and then send the samples to the labs for examination. Meanwhile, the Sultanate puts up a plan to head towards the recovery stage from the pandemic.
We would like to thank His Majesty for giving us the opportunity of joining the COVID-19 group. As per our role as doctors, we are assigned to follow patients either in home isolation quarantine or institutional quarantine. After completion of 14 days of isolation, patients are totally recovered from the treatment process. As per our roles as doctors in COVID-19 group, we're assigned to inform the patient regarding their results, whether confirmed cases of COVID-19 or negative cases. After completion of 14 days of their home isolation, either home isolation or institutional quarantine isolation, patients are totally recovered from their isolation.
In order to enhance the role of nursing and midwifery and enable investments in this sector, the Minister of Health launched the Nursing Now campaign under the auspices of His Excellency Dr. Ahmed bin Mohammed Al-Saidi, Minister of Health. I was part in this event and I have this report. The Sultanate launched today the Nursing Now campaign, which is a global campaign run in collaboration with the International Council of Nurses and the World Health Organization with the support of the Burdett Trust for Nursing. The inauguration was held under the auspices of His Excellency Dr. Ahmed bin Mohammed Al-Saidi, Minister of Health, who said in his speech that the campaign aims to raise the profile of nurses in Oman and support them in their professional endeavors. Al-Saidi pointed out that the time now is increasingly challenging for the nurses and midwives to practice their essential roles for the overall well-being of nations. Nurses, along with other healthcare professionals, risk their lives on a daily basis. For the past few months, the world is combating COVID-19, and nurses have proven to be one of the frontline soldiers.
I'm very proud to launch Nursing Now campaign in the Sultanate of Oman. This year was declared the year of nurse and midwife by WHO, and there was meant to be quite a big celebration in Geneva during the assembly, but unfortunately because of COVID-19 this has to be cancelled. Nurses and midwives are the backbone of any healthcare system. They provide preventative and curative in addition to educational services. They are looking after patients and their families 24/7. They are working around the clock to provide healthcare services, and in many countries under very difficult circumstances. I'm very proud of all our nurses and midwives in Oman, and I promise them that not only because of this campaign, but as we've done before in the Sultanate of Oman and under the directive of the late Sultan Qaboos and of course the directive of His Majesty Sultan Haytham, we will continue to empower our nurses and midwives. We will continue to provide them with all the support they need to take the leadership roles in healthcare all over the country. Of course, the Oman Nursing Association, which is relatively new, they have a crucial role in partnership with the Ministry of Health and other healthcare sector to provide excellent support and service. We rely on them to provide the nurses and midwives the educational support in collaboration, of course, with the private and the public sector.
Needless to say that the nursing is a cornerstone in the delivery of healthcare. What this pandemic has shown, the extreme dedication of the nursing staff in caring for the patients who require a lot of care, be it at the wards or in the intensive care units. Truly, this has shown that the nursing staff and the nursing profession is of utmost importance, and it's really the humane care for the medical profession.
The Minister of Health, Director General of Nursing Affairs, Dr. Jamal Al-Khoudouri, remarked that the Nursing Now is a global campaign to improve health by raising the status and profile of nursing, influencing policy makers and supporting nurses themselves to lead, learn and build global initiatives. Furthermore, the inauguration program was virtually joined by the acting WHO representative in Oman, His Excellency Dr. Syed Jafar Hussein, where he acknowledged the Minister of Health that has resulted in significant increases in its health staff in the last 5 years, whereby the number of physicians in Oman has increased from 16.7 to more than 21.4 per 10,000 population, while the number of nurses grew from 37 to more than 46.3 per 10,000 population. The chairman of Oman Nursing Association said they stand side by side with all nurses and midwives across the country at this extremely difficult time, facing enormous challenges from COVID-19 pandemic. Nurses are confronting not only the overwhelming number of illnesses that stress nurse in-care capacity, but are facing infections risk to themselves. In spite of that, the responses of nurses to coronavirus crisis has gone way beyond the core purpose of 2020, the year designated by WHO as the International Year of Nurse and Midwife, providing a once-in-a-generation opportunity to showcase their dedicated work. However, the contribution and passion of nurses in tackling COVID-19 has focused the national and international attention on the profession in an unexpected but very tangible way. Abdullah bin Ahmed Al-Rubi'i, Sultanate of Oman Television, Muscat. In continuation of the military security body's plans to support the national efforts and the measures of limiting the impacts resulted from the coronavirus COVID-19 outbreak and the implementation of the Supreme Committee dealing with the coronavirus developments, the military and security bodies continue activating the control and checkpoints on the roads linking between the entries and exits of the governorate of the farm. The control and checkpoints are meant for limiting the movement of citizens and residents from one wilayat to another, which help ensuring the safety of everybody residing in the governorate. This comes as part of the national duty of Sultan Armed Forces and other departments of the Ministry of Defense to curb the spread of the COVID-19. Still to come in our news bulletin. An ambulance driver who became jobless after COVID-19 lockdown in New Delhi, India, took an advice from one of his friends and found a job after all.
Non-compliance with the directives of the Supreme Committee dealing with coronavirus COVID-19 exposes you to risk and legal action. Stay safe.
Welcome back to the news from the Sultanate of Oman television. DIAM decided to implement new procedures aiming to enhance the performance of water pipeline network in the Governorate of Dakhiliya. The procedures will include the implementation of a number of works and improvements at a main water pipeline that supply the Governorate of Dakhiliya, as replacing some of pumps and cogs at main pumping stations in Sib Fanja and Samail, in addition to implement a number of mechanic and electric works in the pipeline. The effects of water supply with improvement works will cover all wilayas of the Governorate of Dakhiliya, filling tanks of the Governorate and operating a number of water wells. The Sultanate's average price of the crude oil reached $62 per barrel at the end of April 2020. The National Center for Statistics and Information stated that the Sultanate's total exports of crude oil and condensates reached around 97 million barrels by the end of last April. The statistics also showed that the Sultanate's production of crude oil and condensates reached more than 124 million barrels. To find channels that facilitate procedures for customers in the capital market and insurance sectors, the Capital Market Authority launched a new online insurance initiative. More details in the following report.
The Capital Market Authority launched a new online service to calculate vehicle compensation value after total loss as a result of traffic accidents. This e-service provides information about the value of the vehicle to the holder of the insurance policy to reduce the conflicts that may occur between the vehicle owner and the insurance company in this regard. This system calculates the depreciation ratio based on the definition of the Unified Motor Vehicle Insurance Policy approved by the Capital Market Authority. In addition, this service aims to enhance quality, save time and effort of beneficiaries, facilitate procedures, and develop regulatory aspects in the financial and insurance market sectors. It is worth mentioning that vehicle insurance products hold the second position in the Sultanate of the total insurance portfolio by 26.7%, recording about 130 million Oman riyals in the size of written premiums for vehicle insurance, and 95.5 million Oman riyals in the amount of compensation paid by insurance companies. For the Sultanate of Oman Television, Salih bin Khalfan al-Rahbi, Muscat.
And now let's move to the international news. Turkey today reiterated its opposition to U.S. sanctions on neighboring Iran, saying the coronavirus pandemic has shown that the world needs greater cooperation and solidarity. Foreign Minister Mevlut Cavusoglu made the comments in Istanbul during a joint news conference with his Iranian counterpart Mohammad Javad Zarif, who is the first dignitary to visit Turkey since its outbreak began in March. Zarif said the U.S. had tightened the sanctions in order to damage the Iranian economy during the pandemic. He thanked Turkey for its support. Meanwhile, the ministers said the two countries were working towards reopening their borders for travelers and plan to restart flights between Turkey and Iran on August 1st. The border was closed after the coronavirus outbreak, which hit Iran particularly hard. It has since been reopened for trade only. The novel coronavirus has killed at least 433,493 people since the outbreak emerged in China last December. At least 7.93 million cases of coronavirus have been registered in 196 countries and territories. Of these, at least 3.58 million are considered recovered. The United States is the worst hit country with 115,732 deaths from 2.09 million cases. After the U.S., the countries with the highest death toll are Brazil with 43,332 deaths, Britain 41,698, Italy 34,345, and France with 29,407 deaths. Europe overall has 187,925 deaths from 2.41 million cases. Latin America and the Caribbean, 79,777 deaths. Asia, 23,361. The Middle East, 11,848. Africa, 6,523 deaths. And Oceania, 131 deaths. And now to New Delhi. Before the coronavirus hit New Delhi, Mohammed Amir Khan was a taxi driver making a living in the Indian capital. But after work dried up during a nearly 3-month lockdown to prevent the spread of the virus, a friend suggested he takes on a part-time job at perhaps the only booming business in the country, driving a private ambulance. Here is a report.
A combination of wearing a mandatory PPE kit while driving an ambulance full of COVID-19 bodies under the oppressive summer heat has made working a massive health challenge for him. Coronavirus cases in India are surging, surpassing Italy's count even as the government lifted the lockdown this week. Unlike other countries badly hit by the virus, frontline health workers in India are poorly paid, have minimum training, no insurance, long working hours, and face social stigma.
The PPE becomes so hot that it becomes difficult to wear it, even for half an hour.
Khan said that his wife and 7-year-old daughter moved to their maternal grandparents' house about 3 months ago, and he has not told anyone in his neighborhood about his current profession, as it might draw unwanted attention in a country where health workers have been targeted by neighbors for fear of spreading the infection. Delhi is one of the country's coronavirus hotspots, and hospitals are running out of beds for the tens of thousands of patients. India's total number of cases stood at 320,922 today. The total number of deaths from COVID-19 has increased to 9,195.
A wonderful job Amir found there. This is the Sultanate Oman television. Before we end tonight's bulletin, here are the main points once again. The Ministry of Health announces 1,043 new confirmed cases of COVID-19 along with 1,079 new recoveries. The Ministry of Health launches the Nursing Now campaign to enhance the capabilities of those working in the healthcare field. And the foreign ministers of Turkey and Iran meet for talks. And with that, we do conclude this news bulletin brought to you live from this news center of the Sultanate of Oman television. From the entire news team and myself, we thank you for joining us, wish you a pleasant evening, stay safe and be healthy there.